Greeting to all Physio TV viewers. Welcome to the Little Master series. I am Nidhi Joshi, musculoskeletal PT resident of Sancheti Institute for Orthopaedic and Rehabilitation College of Physiotherapy. In today's session, we'll cover the topic of scapulohumeral rhythm. So let me share the screen. So as I said, we are going to learn about the scapulohumeral rhythm. So the today's objective is by the end of today's session, the viewers of Physio TV will be able to understand the biomechanics of scapulohumeral rhythm and how the shoulder complex work during the elevation and abduction. As we all know that the shoulder is a complex of you have your so we have your sternoclavicular joint, we have your acromioclavicular joint, and we have your glenohumeral joint and scapulothoracic joint. So what it does is this integrated function, how these all joints, this complex helps us distributes the motion between the joint, permitting a large range of motion with less compromise on stability. As we all know that the shoulder compromises is a mobility, okay, and compromises on stability. So that's one point. Maintaining the glenoid fossa in an optimal position and increasing the joint congruency and permitting the muscles acting on the humerus to maintain the good length tension relationship while minimizing or preventing the active insufficiency. So when only just the glenohumeral joint will move, okay, so if this is the scapula and this is the glenohumeral joint, so if this is only moving, okay, then there will be no congruency created. If the scapula also moves with the joint, then the congruency will be maintained. Okay, so we'll see how each and every joint is going to work. Okay, so the scapula on thoracic. So before moving, okay, there is a first phase you need to remember is a setting phase. So total there is 50 to 60 degree of upward rotation of your scapula. Okay, the scapula on thoracic contributes to the elevation by upwardly rotating the glenoid fossa 50 to 60 degree from its resting position. The glenohumeral joint contributes to around 100 to 120 degree of elevation and 90 to 120 degree of abduction. So overall, ratio of 2 degree of glenohumeral and 1 degree of scapulothoracic motion. Okay. So you have your 1 degree of scapulothoracic and 2 degree of glenohumeral motion during the arm elevation is commonly described. And this combination of concomitant glenohumeral and scapulothoracic motion is referred as scapulohumeral rhythm. The Inman and Worker said that during this initial 60 degree of flexion and the 30 degrees of abduction of humerus, the scapula has been described as seeking position, like a stability position, setting phase. As I mentioned earlier, the first is a setting phase. Okay, and there is a 2 degree of glenohumeral and 1 degree of scapular. There is a 2:1 ratio. That is what we call as a scapulohumeral rhythm. Now, as and when there is a stressing of the arm increases, the scapular contribution increases. Now, if I say that all must have seen the patients, okay, you must be going to the clinics and all. The patient who doesn't have the range in the glenohumeral joint, they'll start using their scapula more, or the scapula initiation is first or earlier during the motion. So that is what this statement means, that the stressing of the arm may increases the scapular contribution. So that is how you need to see it. The next is these are the 6 kinematic principles associated with the full abduction of the shoulder. So first is, as we have already seen, based on a generalized, so it's a 2:1 scapulohumeral rhythm. Okay, active shoulder abduction is about 180 degrees. Okay, so occurs as a simultaneously. ऐसे नहीं है कि first scapula is moving and then it is a simultaneous action in a 2:1 ratio. Okay, so it is 120 degree of GH and 60 degree of scapulothoracic upward rotation. The second is the 60 degrees of upward rotation of scapula during the full shoulder elevation is a result of simultaneous elevation of your SC, okay, joint combined with an upward rotation of the acromioclavicular joint. How it is this working and what it is, we'll look forward. So just remember there is it's a combination of your elevation of your sternocleido and upward rotation of your acromioclavicular joint. The clavicle retracts at the SC joint during the motion, and the scapula posteriorly tilts and externally rotates. Okay, during the full abduction, the clavicle also posteriorly rotates in its own axis of motion. The GH joint externally rotates during the shoulder abduction. So what do you need to remember? Principle 1, let's go again. 2:1 ratio. Second, there is a 60-degree of upward rotation with the elevation of SC, okay, and upward rotation of AC. Third is there is a retraction, clavicle retract at SC joint during the abduction. Fourth, that is the scapula, there is an external rotation and posterior tilt. Fifth, clavicle on its own axis posterior rotation, and GH joint external shoulder abduction. We'll go to this again. So there is a elevation. So there is a 2:1 ratio. There is an SC elevation. Then there is a posterior rotation. AC joint, there is an upward rotation, external rotation. Then यहाँ पे there is a posterior pelvic tilt, posterior scapular tilt, and external rotation. Moving on, as we mentioned that there is an AC joint and acromioclavicular joint. So as with the elevation of the as with the elevation of the arm, the scapulothoracic axis of rotation gradually shifts laterally, reaching the AC. So first you will see this is the joint, okay? So first this is the axis of rotation at your SC joint. Okay, when you move, the axis also passes and goes to your AC joint. Okay, so the shifts laterally. So there is a 50% of each contribution, SC and AC. Then tension. So what happens is, you have your coracoclavicular ligaments, and you have your coracoclavicular ligaments. What you need to remember is, so this is the this is the clavicle, and there is a conoid process. So there's a coracoclavicular ligament here somewhere. Okay, so when this upward rotation happens, the scapula is pulled downwards. Okay, so as you now see here, this is the conoid process somewhere here. Okay, when it is going into upward rotation, this is pulled down, the clavicle is still up. So the distance increases as a tension. Okay, that tension is more in your conoid portion of your coracoclavicular ligament. Okay, so what happens? This forces. So this forces the scapula as get pulled down with the muscles pulled up, attempting to upwardly rotate your AC joint. This makes the clavicle to rotate posteriorly, causing the clavicle to rotate posteriorly. At the same time, there is a retraction at the SC, an external rotation of the scapula. There is a slight internal rotation of your internal rotation at the AC joint. Okay, but that is like, it depends. Okay, it to offset more of your external rotation of your scapula, there is a slight internal rotation from your AC. Okay, you can remember in this way. The final component when you need, there is a posterior tilting, okay, of the clavicle will couple with the posterior tilting of your scapulothoracic. Okay, so we'll once again go through all of this with the video. So I am hoping everyone is able to see the video. Okay. So the full scapular abduction and external rotation. So there is a 45-degree of external rotation. Then there is an SC elevation. Okay. Then this is what I was talking about. There is this, okay, which is this coracoclavicular conoid process, which is the most tension. Okay, when there is an AC joint upward rotation and there is an upward rotation of this. This is being stretched. Clavicle will move posteriorly. Okay. Next, we'll just fast forward a little. So it is 25 and 35, as we initially said, the total motion is 60 degrees. So there is a 25 degree of posterior rotation and 10 degrees of external rotation. 45 degree was the glenohumeral external rotation. Now in this, you will see the posterior rotation of the clavicle. So this is the whole rhythm. Retraction, okay, elevation, upward rotation of AC, external posterior tilting, and upward rotation of scapula. This is just the muscle overview, okay? How your abductors are settling. This pictures I have not included the muscle part, but just to like have a gist of it. So this is your, as you know, your upper traps, this is your middle traps, this is your lower traps, this is your serratus anterior, and this is your deltoid. So this in the rhythm, we have covered your uh, kinematics part. The kinetic part is this. So your upper traps is pulling this in the elevation, middle traps, lower traps, and your serratus anterior are working in a conjunction to move and upwardly rotate the scapula, coupling with your deltoid force for moving the arm in elevation. So that's the gist of it. And yes, the references are Cynthia Norkins and Newman. Thank you all. So thank you for your keen listening. I would thank Manisha Sangvi ma'am and Dr. Parag Sancheti sir and Dr. Apurva Shimpi sir, the principal at Sancheti, and the technical team of PhysioTV. Thank you all once again.